Hi, everybody. Welcome to today's live session about vaccine and COVID-19 resources for newsrooms. My name is Rochelle, and I am the Google News Lab Teaching Fellow for Canada. And there are teaching fellows like me in countries all around the world, in countries like in Italy, in the Netherlands, in the UK, in Mexico, Spain, Poland, Japan, South Korea. I wish I could name them all off the top of my head, but that's just a few of them. And the teaching fellows have all worked extensively in newsrooms around the world. But our current job is to connect with journalists to explore digital tools that can enhance their storytelling. So if you're interested in ever setting up training sessions about different digital tools for journalists for your newsroom, here is my email address. Simply get in touch and we can see what's possible. I am in Canada, so this is for newsrooms in Canada when you're emailing me. Training can be in English or in French, and of course, given the state of the world, all training is virtual for the time being. Today's session is the first of several live public training sessions over the next few months. So if you're looking for information about what I'll be hosting, here's the site. Actually, I'll drop that in the chat right now. And you can sign up for any of the sessions that you're interested in. And today's session is being recorded. So if you missed something, a link, or there's a bit of information you want to hear again, or you want to share this with somebody, you can always go back later. For those of you who speak French, pour ceux d'entre vous qui parlent français, cette présentation se fera en anglais, mais si vous avez des questions et vous êtes plus à l'aise de les poser en français, allez-y. So if you have any questions, you can feel free to leave them in the chat. And if you are joining us from outside of Canada, welcome as well. It is so great to have you here. Before we get started, just a little bit of background. The Google News Lab, the team that I'm part of, it falls under the Google News Initiative, the GNI. So my role focuses on the first of these three E's, to elevate and strengthen quality journalism. So my work, if you can imagine it, it really focuses on content. Now, the GNI's other main pillars are about evolving business models and empowering news organizations through technological innovation. And if you have any questions about those two E's, that's the email address where the whole Canada team can be reached, and we'll figure out who's the best person to answer your questions and who's in the best position to help. So gni-canada@google.com. Again, I'm in Canada, so regardless of where you may be joining us from today, that email address is specifically for Canadian news publishers. But the tools we're going to talk about today are for everyone. This website, the Journalist Studio, it brings together many online tools that are useful for reporters anywhere in the world. Some of the tools are built by Google and others aren't. But these are all tools that were selected to help journalists work more securely, more efficiently, sometimes even more creatively. And on the Journalist Studio site, you'll also find a link to a training website where there are courses that dive into many of these tools and more. You can also navigate directly to the training website by going to g.co/newstraining. And all of these courses, unlike today's, they're self-guided. So you can pick and choose the tools that are most useful to you and to your work. And there are actually several courses about verification tools, which would be interesting to check out in relation to our topic today. So we're going to touch on some of the tools that you might see on the site, but not all of them. So if verification tools are of interest to you, it is worth checking out the courses. So on to the subject that you've all logged on to for today's session, online resources for journalists covering the coronavirus. Now, these are the different areas we are going to be looking at together. We're going to start with resources for fact-checking. Then we'll look at some research and discovery tools, then sources for data sets, and we'll wrap things up with tools for accessing experts. And no surprise, the pandemic has kept journalists around the world extremely busy over the past year. And there are so many layers when you've been assigned to report on COVID in some way. So the fact, of course, that it's a global story with very local implications for everybody. That means in terms of public health, the economy, education, it really does touch on everything. Information changing quickly, and sources of information not always able to keep up with the public demand. And of course, there is a lot of false information that ends up circulating. You may have seen or maybe heard about this report from Statistics Canada. It was released last month, so in February of 2021. It's one of the many recent studies about misinformation and the impact on Canada during the pandemic. I'll share the link if you want to take a look at the study yourself. So the focus here was on using online resources to learn about COVID-19. And clearly from the stats, Canadians are not immune to falling for falsehoods. And that's especially because of the speed at which things are shared on social media platforms. So there is misinformation, disinformation, and malinformation circulating more than ever. And it's good for journalists to think about the distinction between these types of falsehoods when they're doing research and interviews about COVID. So to get us all on the same page, let's take a closer look at these three terms. They do often get lumped together, but there are some differences that we can talk about. So starting with misinformation, it was one of the biggest issues at the beginning of the pandemic. People simply didn't know what was true, and often rumors were spread. Sometimes they were simply misguided with the best of intentions. Misinformation could stem from misunderstanding the disease, and maybe even from wishful thinking about false ways to treat COVID. So a good example of misinformation would be claims that circulated, you might have seen this, that something like garlic could be a cure. So misinformation could be an honest mistake. There isn't any intention to mislead people, even though, unfortunately, that's what ends up happening. In terms of disinformation, there are groups or individuals with wide networks and reach who knowingly spread false information. For example, lately we would see a lot of disinformation about vaccines circulating. So disinformation could be motivated by different factors, maybe money, maybe to serve a political gain, or maybe just for the sake of it, really. So when disinformation is shared, it often turns into misinformation. So someone hears or reads something, they don't realize it's false, and they share it unknowingly. So we end up going from disinformation back to misinformation. But lastly, malinformation. Now, this is true information that is shared to cause harm. So something real that was taken completely out of context and done so with malicious intent. Now, the distinction between this and disinformation is that disinformation contains outright lies with no element of truth, whereas malinformation has something that was true at the heart of it, but it's been twisted into a different story. Now, these three definitions are all from First Draft, and the First Draft is an excellent resource when talking about the importance of fact-checking. So during COVID, they have released so many resources and different reports. I'm going to drop a link directly to their vaccine and misinformation project in the chat for anyone who wants to check that out. There you go. Before we move on, there are two games I'd like to share. You can play these yourself. You may consider sharing them with family and friends as well. And these will test your understanding of how false and misleading information about COVID can spread. So this one you're seeing on your screen right now is called Go Viral. It's out of the UK from a team associated with the University of Cambridge. And it is available in French as well. And it has this choose your own adventure feel to it, where you're prompted to select different responses or answers to move the conversation along. So it's a fun learning opportunity. And the second one, this one's only available in French, and it's from Radio Canada. It works the same way, but it goes more in depth with different capsules. I guess we can call them different sections. Now, this game is from the team at Décrypteur, And they exclusively work on following false information that spreads online. They then break things down and they highlight the disinformation and then provide fact checks to get to the truth. So this game is quite fun. It's funny, it's informative, and you can find it on their main website that I've shared on the slide, but I'm going to drop a direct link to the game as well in the chat. And if you speak French, it might be fun to play. So let's look at some of the different fact-checking resources that are available online, and that could be especially useful for journalists. None of the following are games, but it can still be fun and interesting, and most importantly, informative. This is certainly not an exhaustive list, but if you've been covering COVID for months, for a year now, I hope you will take away maybe a new tool or two. One of the very first things you can do in terms of fact checking is to search a tool called the Google Fact Check Explorer. Here you can see if a story that you're questioning, if it's already been debunked or not. Now, this is Google's attempt to index all of the world's fact checks in one place. I can open it over here, and you can see, I'll go back to the main page. This is where you log on. You can simply click Recent Facts, and you'll get a bunch of recent fact checks. And you see they're classified false, misleading, missing context. These can all help you get some answers faster when you're working on a story about COVID. You can also search, so we can search for vaccine, and you'll get results only related to vaccine. And the last thing I want to show you is a little trick. If you look at the URL at the top and you see the little EN, well, you can change that little EN to an FR. And that will change the results that populate only to those that are in French. It's a useful little tip. The other tool that lives on this page, if you look at the tabs along the left side, is the Fact Check Markup tool. And this is how fact check work that you might be doing yourself can appear as part of the Explorer tool. So you'll see the steps to follow in that tab, and it's on the technical side. So this tool will create what's called a claim review markup on the article in question. And then this markup, which is structured data, it contains information about the fact check. So for example, what the claim is, who made it, what's true, what's false, what's misleading. And I would say that depending on your publication and the size of your publication, you'll likely have to talk to your webmaster and your managers about this. So Fact Check Explorer is one place you can perform targeted searches for fact checking. And there are other databases to consider as well. Here are just three you could explore that work similarly. So the first one's from Agence France Presse, the next from the Pointer Institute, and the third is from Full Fact. And I have Full Fact open on my screen, and we can see how they neatly organize by subject areas that you can click on. So we can click on treatment, and then all the fact checks about treatment that they've conducted are all neatly organized here. Here, I'll actually drop, I'll try dropping all three links at once, and we'll see if that works in the chat. I think it did. Wonderful. Or yes, it did. All right. Moving along, I'd like to share these three dashboards as well. They're all from the Ryerson Social Media Lab at the Ted Rogers School of Management, which is all being built and managed by a team here in Canada. And it's part of a project called COVID-19misinfo.org. And I really like their slogan. It is, come for the misinformation, stay for the facts. Now, these dashboards are bringing together information from so many different sources, and there truly is so much happening here. And it's exciting that it's being done all through a Canadian lens. When we get to our final section of today's presentation about tools for accessing experts, there's going to be some additional resources for fact-checking to explore. But for now, let's leave it at this with this excellent resource. And let's jump into tools for research and discovery when reporting on COVID-19. So what we're going to look at are resources that you may consider checking if you're looking for content to complement a story, or maybe you're looking for new and different and local content that is for your audience in your geographic area. This is a really cool tool that is that's quite new, at least within the last year. It's called the Google COVID-19 Mobility Report. It gives an idea of how a community is moving around differently because of COVID-19. So for Canada, this can be broken down to the country level or the provincial level. And within the provincial level, you can look at the different regions. So the information that's generated is made up of aggregated insights, and it's all anonymous. It's the same way data is used on a tool like Google Maps, for example. And the mobility report, as you can see, available in English and in French. You just select which language you prefer. When you do select a location, you get a breakdown like this. And it displays the change in visits to places like grocery stores, parks, and transit stations. You can see here I went under the province of Ontario and pulled up the report for Hamilton. And the strongest change that's indicated from this report is in transit stations from the baseline to when this sample was pulled. Interesting to note, these reports will be available for a limited time. They were introduced to help public health officials in their work to stop the spread of COVID-19, but they are publicly accessible. So you're going to want to check them out now. I think I have it open here, and I can quickly show you just how you walk through this site. So when you're on it, you would search here. I had done it earlier, so let's. Maybe here we go. I'll get the link. It has to load. You search by country. We can input Canada. Now, when you click on Canada, you have all the options of the provinces or the country as a whole. So here, as I mentioned, English or French. You can download the whole country. So as you can see, this is a report for Canada as a whole and then divided by province. If we go back, we can click on Alberta and download only Alberta. The latest data was pulled from March 14th for this report. And when we go into Alberta, we can see that we can see more narrow data for Medicine Hat, Lloydminster, Edmonton, and so on. Another tool for your consideration in terms of story discovery and COVID, what is the public looking for online? Which brings us to Google Trends. Now, this is the Google Trends page for Canada that automatically generates popular COVID search topics. It's accessible from the main Canada Trends page, but here is a link directly to what you're seeing on the screen right now. It is important to remember what Google Trends is and isn't. This is for always, not only for when you're talking about COVID reporting. So Trends tells us what people are searching for and where and when they are searching for it. Now, the data is interesting and useful, but it is not a scientific poll of any kind. So remember, it always reflects the search interest. So a spike in a particular topic doesn't mean that topic's popular or winning. It just means that for some unspecified reason, many people are searching about it. So Google Trends data should always be considered as one data point among others before you draw conclusions. Here I did an extremely simple search comparing the search interest in the COVID-19 vaccine and COVID-19 testing in Canada. And we can see the relative steady interest in testing over the past year. That's what you're seeing in red. And then you see a spike in searches about the vaccine in blue. It happens around December. So this is an extremely obvious example, but by inputting different search terms and topics, you could yield some pretty thought-provoking results. And the last tool I want to show you as part of our section on research and discovery is Pinpoint. We're going to be doing a full session about Pinpoint and investigative journalism on April 8th. So what I'm going to show you now is sincerely just a very quick overview. Pinpoint allows you to quickly search through a high volume of documents all at the same time. And it was developed specifically to help journalists do this. So when you have a lot of files, what you do is you upload them to Pinpoint and you create something called a collection. And a collection can contain up to 200,000 documents, depending on the size of the files. So all that to say, you can upload a lot to your collection. These are the different types of files that are compatible when working in Pinpoint. So pretty much anything standard that you can imagine: PDFs, slideshow files, different kind of text documents, including email. This also, which is pretty cool, includes audio files and image files. So with the images, the tool uses OCR, which is optical character recognition, to identify text within photos. And then for audio files, Pinpoint creates transcripts of the audio that are then searchable, and the audio file becomes embedded in that searchable text document. So you can click and listen as you read. Again, a full demo to come on April the 8th. But to give you an idea, I have Pinpoint opened here. And you can see at the top of the page is my workspace where collections I have created are stored. I can click on this one that I created recently about PPE, personal protective equipment, and Canada. You can see I have 44 documents that are part of this collection. And right away on the right-hand side, I can filter my collection by people, by organizations, and by locations. So let's say I want documents that mention the Government of Canada, and I want those that are only mentioning Alberta as well. So you can see that Pinpoint has isolated from the 44 documents we had at the beginning, narrowed down to 7 where only the Government of Canada or Alberta is mentioned. The other feature I'll show you quickly is search. So if I search for PPE in my collection, the tool brings back all the references of PPE, but it also recognizes that maybe I'm looking for personal protective equipment written out in full. So it not only recognizes my search, but also synonyms to the search term I've provided. And the last thing I'll show you as part of this super condensed demo of Pinpoint is that the tool also captures handwriting. So what you're seeing here is a handwritten note that I had done, types of protective equipment for COVID-19, a list I'd made, and I very messily wrote goggles on an angle yet on my note, and the tool was able to find that as well. So there's lots of different things you can try and different applications for Pinpoint. In fact, I'd like to share quickly 2 examples of Pinpoint that have been used during COVID. So the first one is from Verificado in Mexico, and reporters listened to the Mexican president's daily COVID briefings and then used Pinpoint to fact check what he was saying in real time against archival transcripts and other material. So they uploaded all this content into Pinpoint and had it at the ready when the Mexican president was doing his daily briefings to fact check what he was saying. USA Today also used Pinpoint during COVID. The reporters requested records from all 50 states with confirmed COVID cases at the time of their reporting. They uploaded these into Pinpoint, and in this case, the locations filter was useful. Remember, we saw it on the right-hand side of the screen. Well, they were able to create a database using this, which allowed people to look up if there were COVID cases in facilities where they had loved ones, which hadn't been the case. The information hadn't been easily accessible before they were creating that database. So 2 good examples of when there's a lot of information to go through in your reporting. So right now we have seen resources where you can look for and gather information for COVID-19 reporting. But what about full data sets? Let's take a look at that. Now, data sets have led to amazing visualizations during the pandemic, like some of the ones you're seeing here from the New York Times. There have been some fabulous examples of how visualizations can make a complicated story like COVID more digestible for the public. So visualizations involve using all kinds of charts, graphs, and maps to help tell stories. I'm going to drop the New York Times, or one of their visualization stories, one of the stories that relies on visualizations heavily, in the chat so you can take a look. Now, you can create amazing visualizations even if your newsroom is considerably smaller than that of the New York Times. There are many different data visualization tools, and if you're working with a larger outlet, there may be one they prefer you use because it's already integrated into the existing CMS. But if we think beyond those kinds of constraints, Flourish is a really great tool. And in the case of COVID, the team at Flourish has created templates that can be customized and then used for free with proper credit. So you can access Flourish from the Journalist Studio or directly at this site. There you go. And we can open it here on my pages, on my screen as well. So if we scroll down, you see there are plenty of ready-made templates that address different issues of public interest to COVID. They're very easy to manipulate and to change the countries. Important to note that everything you're seeing, the data is drawn from the European Center for Disease Prevention and Control as published by Our World in Data. And it's always cited at the bottom of each visualization. You can also make your own visualizations beyond these templates, although these are at the ready. You can make a free public account on Flourish and use that. And journalists can also upgrade for a free Flourish Newsroom upgrade. So I can actually show you where you have access to that. If we go to the main Flourish page, we go under pricing. And then at the bottom, you'll see here, you can apply for an upgraded account if you're a journalist. When you are using charts and graphs or any type of visualization, I do want to put out a caution. It is important to consider why you're doing so. So this type of visual imagery can be really powerful for telling a story, especially when the concepts and the numbers can be difficult to grasp otherwise, but it is important to use data properly. And this article was published around this time last year from Nightingale, which is a journal dedicated to data visualization published by the Data Visualization Society, appropriately. I'm going to share the link to this as well if you want to have a read. There are some really great tips and things to think about and to consider if you are using data visualizations in your work. With that said, using data responsibly can lead to very strong and important journalism. So Dataset Search is a specialized search engine for data sets. It draws from thousands of repositories from right across the web. In Canada, the COVID-19 Canada Open Data Working Group is made up of volunteers with expertise in everything from epidemiology, public health, data science, and these are mainly professionals from the University of Toronto and the University of Guelph. And data collections they have assembled are being used by newsrooms across the country. In fact, that's how I first found out about this last year. They were being cited as the source in data visualizations on a few major Canadian news websites. So if you're looking for content collected through a Canadian lens, this is an excellent source. So we're at the last section of the presentation now, and as part of this, I'd like to share some online resources that are useful for finding trusted voices to consult as part of reporting. So in the case of COVID-19, a lot of journalists who never had to consider health reporting in the past have been thrown in and into very complex subjects at that. And in some cases, working as quickly, if not even faster than maybe on their usual beats. So regular sources for expert explanations and reactions, like university websites that have expert lists, organized by subject matter, these are still valuable and provide access to professionals in different resources and disciplines. I was on the McGill University website yesterday, and like most Canadian university and colleges, they've narrowed down their usual roster of team members who they make available to the media, down to this more tidy list that's applicable for COVID-19. And they've of course listed out the common subjects that are discussed and that these individuals can comment on. And what's useful is they also indicate who speaks English and French. So I'd encourage you to check out universities and colleges in your area that have done the same, especially when you're thinking about content through a local lens. Because of the widespread interest and need for reaching experts in reporting around a pandemic, there are several new COVID-specific resources that have been built over the past many months. So before we get to some of those, Google Scholar, which you might have heard about before, it's always a great place to look for studies and for research and subject matter experts. So Google Scholar indexes scholarly research, literature from academic publishers, professional societies, from universities, and many other sources. And if you see a hyperlink on an author's name, you can click there and you can see other articles that they have published. And then from there, you can often see if that professional has linked to their professional or sometimes personal website. And there's often contact information that you can follow through if you want to contact that individual for information or for an interview. So in this example you're seeing on the screen, I have used Google Scholar in French just to show that it is possible to narrow results to French if that's of interest to you in your work. So this is just a bit of a sidebar that I thought was interesting, how researchers are using Google Trends, which we talked about earlier, as part of the way they're watching COVID-19 developments. So they're looking into subjects like public awareness, preparedness, and even trends as a data point for predicting COVID spread. It's really quite interesting to look at what people are searching, and that this information, it was searching online, and that this information is being seen by researchers. And you can do a search like this yourself just to see what appears. All you have to do is search COVID-19 and Google Trends within Google Scholar and see what comes up. And I have to say, I got lost in reading about some of these results for an hour or so. So it might be something you'd like to check out as well. But let's turn to resources built specifically with COVID-19 in mind. So learnaboutcovid19.org is a collaboration between fact checkers, journalists, and medical experts. The project's goal is to get answers for journalists as quickly and as responsibly as possible. So this is actually a global resource, and it brings together experts from the Harvard T.H. Chan School of Public Health and the Stanford Health Communications Initiative, along with all other scientists with experience from around the world, not just limited to those two institutions. So when a question is answered, it is then tagged with a topic and added to the database. That's the list you are seeing here. But if you scroll through these questions and your question hasn't been addressed, all you have to do is click the Ask Our Experts question button in the top right corner of the screen, which I've kind of magnified here. You can submit a question to their panel of experts. And this is the panel that opens. And one of the questions in the short questionnaire you have to fill out is, what is your publishing deadline? So this is truly a tool that is being made with the media and with the media's deadlines in mind. Now, this is another resource. It's hosted by the same nonprofit organization and various partners, but it is accessible by its own URL. It's called the COVID Vaccine Hub. And with news around vaccines being released so quickly, this is a space for journalists and fact checkers to access the latest and trusted information. And it was actually just released earlier this week. It is also a global resource with contributors from all corners of the globe who are committed to evidence-based information. Now, they expect to also have something like a 24-hour service available soon for journalists and fact checkers to help answer specific questions, specifically about vaccines. And one final resource to share. This one is from the Science Media Center, and they make quotes from leading experts available on the latest subjects and questions about COVID-19. So if you go onto their page, there is a statement about the rigor with which they select their experts for commentary, and also their commitment to evidence-based science. And this is a two-way street. They support both journalists and scientists, and they are trying to bridge the gap to get the most accurate information out to the public. So here is a post from yesterday that we can look at together. It is with expert reaction to an announcement from the European Medicines Agency about the Oxford AstraZeneca vaccine and blood clots. So right away, you can see the different experts. The different experts that they have consulted for quotes. So you see the expert's name, followed by the reaction that they have provided. Then there are links to the original statement and more information. And lastly, any information about the experts that would be relevant to know in this context. So where funding for grants may have come from, for example, or boards that these individuals might sit on. And I'll give you that URL in the chat so you can click easily as well. But that does bring us to the end of today's presentation. I thank you so much for taking the time to join, whether you've joined live or you're watching back this session at a later time. Again, this is the training center from NewsLab, where you can find different training courses at any time and do them yourself, choose which are the most interested to you on your own schedule. And I will be doing other sessions like this along with news fellows that I work with all over the world, these live sessions hosted on YouTube. So here's the site again, where you can sign up for Canadian sessions. The next one is going to be about tools and tips for freelance journalists. Please feel free to get in touch with me at any time with questions. I will leave that slide up with my email address and with how you can also contact other members of the team. But for now, thank you again, and I hope so much to see you again soon on one of these GNI live sessions. Have a great day.